Hello, everyone. My name is Brad Bradley. I'm the Public Health Preparedness Systems Manager for the Virginia Department of Health. And welcome to today's Office of Emergency Preparedness Lunch and Learn session. Today's session we're going to hear from Christina Stark. She's the CDC Senior Preparedness Field Assignee for the Office of Emergency Preparedness, and she's going to talk about the PHEP capability number 1, community preparedness. So without further ado, you go right ahead.
Thank you so much. As mentioned, so today's presentation, we're kind of kicking off this series of lunch and learns that detail the CDC's Public Health Emergency Preparedness, or PHEP program capabilities. So starting off strong with capability 1. So some of the goals of today's presentation are to, 1, provide a brief introduction to what CDC PHEP program is. Then provide kind of an overview of community preparedness and its significance for the Commonwealth as well as for our local communities. Then we want to define some of the key elements of community preparedness, and finally identify some of the roles that VDH and our partners play in community preparedness, and ultimately building more resilient communities. So we'll start off with a quick introduction to PHEP. So PHEP, or the Public Health Emergency Preparedness Program and Cooperative Agreement, was established in 2002 in order to help health departments build and strengthen their abilities to respond to a range of public health threats. As you can imagine, some of the events that kind of incited this establishing this program, the anthrax attacks as well as the 9/11 attacks of 2001. And so this was generally a program created to build up our emergency-ready public health departments that are flexible and adaptable. And so then in 2011 rather, CDC established these 15 capabilities that ultimately serve as our national standards for public health preparedness. And they serve as a framework for our work in the public health preparedness programs to plan, operationalize, and evaluate our ability to prepare, respond, and recover to public health events. So these capabilities in turn are kind of our framework for many of our actions as public health preparedness programs. And what's important too about this program is that it ultimately serves as our funding for a lot of our OEP staff, as well as some of our epidemiologists in the state. So to provide some more context, just an overview, these are the 15 PHEP capabilities. And I want to preface that these are not organized by importance. All of these are necessary for preparedness, response, and recovery, but they're actually organized by alphabetical order and general domain groupings. So the capability that we're talking about today is capability 1. It's grouped with capability 2, community recovery, for generally the idea of community resilience. So keep an eye out also for some of these future sessions, which we'll be having the rest of this year through this Lunch and Learn session. So what is community preparedness? As defined by PHEP, community preparedness is the ability of communities to prepare for, withstand, and recover from public health incidents in both the short and the long term. And so PHEP identifies these 4 functions that a community has to complete in order to prepare for these adverse public health incidents. So that's to determine the risks of the health jurisdiction, strengthen community partnerships to support public health preparedness, coordinate with our partners and share information through social networks, and coordinate training and provide guidance to support community involvement in preparedness efforts. And we'll be going over these capabilities in depth throughout this presentation, but I just want to preface by, looking at these functions, we see that kind of the bedrock of community preparedness are these partnerships that we establish. Much of the functions that are done are through active and detailed engagement and coordination with our partners, with our stakeholders, and with our community members. So many of the tasks associated with these capabilities are ultimately best performed by other partners, and we as a health department just play an advisory role. So with that, let's dive into some of these functions. So first, we have risk assessment. which makes sense in part. In order to, properly prioritize our preparedness efforts, you have to understand what the most likely threats to the jurisdiction are. So we describe this function as identifying potential jurisdictional public health, healthcare, mental and behavioral health, and environmental health hazards. And so I'll kind of, join these all together when I'm referring to public health services and kind of identify these services that are outside of public health, which is the healthcare, the mental behavioral, and the environmental health aspects and services. So, and so then we want to assess what the human impact is due to the interruption of these services and the supporting infrastructure. So one of the first tasks in risk assessment is to conduct a public health jurisdictional risk assessment, or a JRA, or in other terms, a threat and hazard identification risk assessment, which is a FIRA. And this is an assessment coming of our past, our current, and our future risks to the health, safety, and property of the people within our community. So a JRA, ultimately, it helps us to identify some of the factors that might impact health outcomes in our jurisdiction by allowing us to identify the threats and the hazards of most concern. It helps us to understand the risks and determine the level of capabilities that are needed to address those risks. It allows us to target and gauge community's capability level to address the public health needs. And in turn, it allows us to identify and address the gaps and barriers to these capacities. It's important to take into consideration that when we're assessing these risks, we must put procedures in place to identify those at-risk populations who are disproportionately affected by an incident. So as we know, there are community members with access and functional needs that we should consider, as well as some of those cultural, socioeconomic, and demographic factors. So because this is a community-wide effort, it's crucial to conduct these JRAs in collaboration and maybe even have another partner lead this initiative. So for example, I put up on the screen the Virginia Department of Emergency Management, or VDEM's hazard mitigation plan, which is completed in collaboration and with input from VDH, but ultimately is organized by the Virginia Department of Emergency Management. So as you can see, they organize the threats from most hazardous or most likely to negligible. And so it's important to prioritize response to these risks, in particular, those high risk. And then the next task is to support our jurisdictional partners and stakeholders to identify services and reduce and mitigate jurisdictional public health risk. So we want to support our community partners and stakeholders in identifying these public health services that are capable of us supporting our public health risk reduction strategies and mitigation efforts. So regardless of the role that we play, preparedness programs are responsible for understanding how the needs of the people with access and functional needs are covered in jurisdictions. I want to also point that it's critical for our jurisdictions to identify the populations who are transportation dependent and identify transportation options within in the context of a public health incident. Limited access to reliable transportation could influence compliance with some of the public health recommendations that we make, especially in the case of evacuation orders. So we have to keep that in mind, that some resources like public transit or community networks, social networks might not be available within a response. And so we need to address those and identify the respective roles and responsibilities in creating transportation options. And so we also need to, I also want to clarify that, this might not be something that we are responsible as a public health department, but rather is in collaboration with our local transportation agencies and our NGOs within the jurisdiction. So community partnership. So this is the second capability and it's defined as identifying and engaging public and private community partners to assist with assessing risks, mitigating health hazards, defining community roles and responsibilities, and strengthening community resilience. So I implied earlier that the JRA or the THIRA was kind of the starting point to emergency preparedness, but realistically, those risk assessments can't even begin without already cultivating that community partnerships. So it's the community and faith-based organizations that we have in our communities bolster the resilience of our community. They help to spread the word of public health, and they could provide additional resources like space, people, and funding opportunities, etc. So as I mentioned before, BDH will not always be the lead agency for all public health services and responsibilities. So it's important to identify who supports BDH and who does BDH support or advise. And so it's important to participate with community partners to identify and implement additional ways to strengthen our community resilience, even outside of explicit public health services. So this is just a brief, non-exhaustive list of some of the partners that we have to work with to build resilience in our communities. So in particular, you have your state, your local, and your tribal governments, agencies in public health preparedness and response. You have your EMS, your healthcare partners, your behavioral health partners, environmental health, childcare, and the list goes on. And I'm sure you all have experience with working with these partners. So it's important to also manage those relationships even within our health districts, within the different offices. Everyone plays a role, and it's important to cultivate those relationships. We want to cultivate the relationships with our external agencies, regional organizations, and I think ultimately relationship building requires being aware of and responding to the needs, wants, and desires, and competing interests of other partners. So you want to participate with community partners to identify ways to bolster resilience. So some of the tasks associated with community partnerships are to engage community partners and other stakeholders in supporting risk mitigation. So we want to implement strategies that ultimately bolster ongoing collaboration with partners and stakeholders who can provide services to mitigate the threats and risks that we've identified through the JRA or the THIRA. And part of the strategy is also that you may want to put procedures in place to, for example, register, your healthcare personnel, like physicians, nurses, and allied health professionals, as well as some of the faith-based and the community-based, as well as professional organizations into our personal, volunteer agency, which is the Medical Reserve Corps. So that's, if you're not familiar, the volunteer arm of our emergency preparedness office. So you also want to put procedures in place integrating community and faith-based partners into each stage of our public health incident or event. So next part is coordinating the delivery of essential public health services. So in this, we want to partner with our organizations responsible for some of those essential healthcare and human services to make sure that we are covering all the services that are provided as easily and as early as possible within our response, and especially in that recovery and that return back to some of the public health systems after an incident or an event occurs. Then we want to incorporate some of the partner feedback to make sure that we're improving continuously on emergency operational plans. So I'm sure you all have been involved in after-action reports and after-action meetings, and so we want to establish and implement that quality improvement continuously throughout the response, throughout the preparedness aspect, and in that recovery especially aspect. And so this can be through, the formal after-action processes, or through town hall meetings, or through just engaging with the community. And we want to collect that feedback and incorporate it. Once we collect it, we need to make sure that we are taking that next step and incorporating it into our plans, into our trainings. But we'll get more into that later on in the presentation. And then, so some of the other venues that we might want to leverage are, going to town hall meetings, to the community gatherings, to conferences, and other social engagements. And so then finally, the final partnership task that we have here is to engage community spokespersons to deliver public health messages. So, we can try very hard and we can develop this public health message that is the correct message, but ultimately, if we aren't utilizing the right messenger, then it's not going to be received. So we have to work with our needs and our partner organizations to gain insight on what, pre-developed preparedness and disaster communication messages are accessible, and understandable and culturally and linguistically appropriate for the populations we're intended to inform. So we need to identify the partners to help communicate this public information, to communicate alerts, and to communicate warning notifications. That's because it serves a critical component of our, of successful public health mitigation efforts. All right. Okay, so on to the next capability. So this capability, of course, goes hand in hand with our community partnerships capability. And we define it as engaging with community organizations to foster social connections that ensure availability and community awareness of public health services in response to an incident. So ultimately, we want to promote awareness and access to public health services, as well as some of those partner services like healthcare, human services. And we want to address any, of course, throughout this, address any access and functional needs for our at-risk individuals. So the first task within this capability is to engage with community partners to coordinate preparedness efforts. So we want to coordinate with our community partners and make sure that they understand how to access and connect their stakeholders and their community partners and populations so that they are served with public health resources during an incident. The second task at hand is to provide opportunities for community health services to participate in public health emergency preparedness activities. So when we're developing, implementing, and reviewing our public health preparedness efforts, we want to engage with public health, healthcare, human services, mental behavioral health services, and some of our environmental health service organizations, and ensure that we can provide those essential health services to our community in these times of need. And so then the final task at hand is to leverage some of those community networks to disseminate information during an incident. So we want to use some of those local businesses, some of those community and faith-based organizations, our radio and our broadcast media, as well as some of our social media, different medias, as well as text messaging, and other channels, as applicable, as needed in the communities, in order to communicate and disseminate timely, relevant, and accessible, as well as culturally appropriate information throughout our response to an incident. We also need to put procedures in place and problem-solving strategies to ensure access to public health and services, and identify and engage community partners and stakeholders to support the restoration of community networks and social connectedness at the end of an event. It's crucial to kind of invoke that social cohesion that might have been lost during a threat. And so then we come to the final capability, which is training, guidance, coordination, which is defined as providing public health preparedness and response training and guidance to community partners and other stakeholders in order to address risks, including but not limited to those that were identified in our JRA, or jurisdictional risk assessment. So we want to participate in awareness trainings on how to prevent, respond to, and recover from incidents that might adversely affect our public health services and our public health within our communities. So the first task that's been identified is to leverage those existing disaster preparedness and response trainings and educational programs to build community resilience. So we want to make sure that we are coordinating with our community partners that we've established and our stakeholders to implement existing trainings and educational programs that can incorporate community-based approaches to preparedness and recovery. And so task 2 is to promote training and guidance for community partners. So we want to integrate health district response plans with outside entities. We want to coordinate with them and make sure that they fully understand what is expected of them during a response or during the preparedness and the after action and the recovery from an event. So we want to promote these training initiatives for community partners and our other stakeholders within public health, healthcare, human services, mental behavioral health services, and environmental health services. And then the final task at hand is to provide guidance to groups representing at-risk populations. So ultimately, we want to promote the trainings and education that we've developed with the community partners and our stakeholders to support the preparedness and recovery for those populations that have been affected and may have been disproportionately affected by an incident or event. And we want to base that on the jurisdiction's identified risks, as we've done through the JRA, as well as increase awareness of and access to the services that may be needed during and after an incident. So I put up here one example of something that we've done as an agency, which is offered the community-based emergency response series, which is something that it's a training series that we offer throughout the state to different communities, and we invite different community partners specifically based on the topics at hand to, one, provide that training, but also to inform future trainings and future actions. So just provide that as an example of some of the work that we've done. And so I just want to put some slides up or some resources up for some of the some places that you can find more resources on community preparedness and engaging with our partners. So some of the VDH specific resources we have are our intranet website for emergency preparedness, as well as our external website, which has a list of trainings and opportunities, different events. And then I put our MRC website, as well as our communications hub, which is informed by a lot of the work that we've already done with our partners throughout the state and regionally as well as locally. So providing some resources, some communications resources that have already been been created in collaboration with these partners. And then I put some of our partner resources as well, who have informed some of our work, as well as develop resources specifically for some of these capacities and these capabilities, including NACCHO, ASPO, CDC. I've attached specifically the PHEP response capabilities, as well as information for individuals with disabilities specifically, and some of our state agency partners as well, like VDEM, DSS, our Department of Social Services, and then information for specific groups from CDC. That's the end of my presentation. So if there are any questions, I'd be happy to answer.
Hey, everybody, if you want to put your questions in the chat, or you can unmute yourself to ask questions, go right ahead. We are ready. Well, if there aren't any questions, there's one. Jack Jones just asked, how long is your assignment to VDH and what brought you to this position?
Well, that's a great question. This, and I will say, I am here in part through the PHEP program as well, myself, as well as we have some other assignees like our career epidemiology field officer, Katie Kirkchin. And so my initial assignment, I am an embedded staff member, so I don't have a limit to my assignment. So I am here and essentially act as a CDC, a VBH employee. And what brought me here was, some of the efforts that I had done previously, specifically with some of our access and functional needs partners, and understanding, the importance of, specifically community preparedness, as well as the other aspects of emergency preparedness to make sure that, we're building these resilient communities, and we can rely on our partners as well as provide those essential public health services to our communities and make sure we mitigate the amount of risk and hazards that we experience in the community. So I think that's what drew me to this position.
Nancy Bryant is asking a question I'm not sure we can answer here, but any word on whether we will have EPR flu vaccine this year? They're getting questions. I would suggest that they reach out to Susie Silverstein or Bob Moskoff for answers to that question, because I don't think that we can provide that here. Any other questions? Beverly Hill says, thank you for this, Christina. I have to jump off, but enjoyed it. And Jack Jones says, thank you.
And if you have any follow-up questions after the meeting, I have my contact information here. I'm happy to answer any questions that may pop up, as you process this information.
All right. Well, thank you, Christina. And the video for the archive video for this particular session will be available and trained sometime within the next week. And if you have any questions about that, you can contact me. I'm Brad Bradley, and Christina has her email address right there on the screen. So you can contact her with questions about the PHEP Capability 1 community preparedness. So without further ado, we'll let you have the rest of your day. Thank you all for attending. Thank you, Christina.
Thank you all.